What if I told you that there's a vaccine that can protect you from certain types of cancers? Human Papillomavirus, or HPV, is found in about 95% of cervical cancers. It is the cause of certain anal cancers as well as penile and oral cancers. HPV is the most common viral infection in the reproductive tract. And most sexually active males and females are likely to be infected by HPV at some point. The good news is that about 90% of cases will resolve on their own. The bad news is that it can lead to genital warts or some cancers. HPV is transmitted via sexual contact, and like I said earlier, it is the main cause of cervical cancer. Cervical cancer, according to World Health Organization, is the fourth most common cause of cancer among women globally, with an estimated 604,000 cases and 342,000 deaths in 2020. Cervical cancer is highly preventable. According to CDC, as many as 93% of cervical cancers could be prevented by screening and by HPV vaccination. Now, concerning oral cancer, many cases have been linked to HPV infection. According to the CDC, recent studies have shown that about 70% of cancers of the oral pharynx may be linked to HPV. The main risk factor in getting infected by oral HPV is having multiple oral sexual partners. Remember I said earlier that HPV is the commonest viral infection in the reproductive tract. Knowing this, the more sexual partners you have, the more likely you are to come in contact with a person with the virus, and this makes the risk of contracting HPV infection higher. Oral cancers are treatable when detected early. However, oral cancers are usually diagnosed when there already has been spread to the lymph nodes, and this tends to complicate prognosis. Now, please don't get me wrong. I'm not saying that oral sex causes cancer. I'm saying that oral sex with a person infected with HPV can spread the virus to the oral pharynx and may lead to a HPV-associated issue such as cancer. HPV is detected by cervical screening in women. It is detected in men by the detection of a small bump around the genitals known as genital warts. Now let me talk a bit about HPV vaccines. There are 3 HPV vaccines available: Gardasil, Gardasil 9, and Cervarix. They are recommended in ages 11 to 26. Although people aged 27 to 45 could still get the vaccines, but the benefits are less and they've more likely already been exposed to HPV. And I must say this, if you're sexually active, especially if you have multiple sexual partners, I recommend you go for screening for STIs every 6 months. Also, practice safe sex. Use condoms. They are protective against STIs and unplanned pregnancies. Condoms are not as protective against HPV as they are against other STIs. That is why vaccination and screening are very essential in preventing human papillomavirus. If you want to learn more on vaccines and understand why you need them, please subscribe to my page, Men with Cred, and turn on your notifications to alert you for the next video drop. Please like, share this video, and leave comments and ask questions. Thanks for watching. I'm Dr. Adedotun Ayodele, and this is Vaccine Doc.
Ain't no slack in the beggy, infections acting all deadly, diseases emerging, spreading, and it's happening already. We need vaccines on steady, we need action on every to eliminate disease, we attacking them early. Prevention is better.